Everybody familiar with putty? We mix together to make a uniform colour. That's going to go in the impression tray, okay? And then what we're going to do is attach this little light wafer, okay, across the top of the putty. Everybody's seen those before, okay? What these do, okay, they'll actually increase the amount of resistance when you're trying to see the impression as well, which adds to the amount of force you need to use. But what it's going to do is stop you actually capturing all the sharp anatomical detail. Okay, so you're not going to get cusp fissure detail, you're not going to get marginal detail. What you're actually doing is creating a special tray using the putty. With me? And it wants to be a deep tray, as deep as your actual impression tray, but specifically shaped to your own patient's mouth. Because then what you're going to do is fill that with the light-bodied wash and reinsert it, and that's what's going to capture the fine detail. Okay? And so it really came about with the introduction of the short-term orthodontic systems. Now, for those of you that do Invisalign, you'll be aware that they send their own trays. They're quite fussy like that. They like you to use their trays and their trays only. For any of the other short-term orthodontic systems, you just use normal disposable trays. And this is where it really comes in that you need a tray with a built-in handle, because if you're trying to take a silicone impression with a removable handle, it's going to be really difficult. The tray handle's going to come out first. Okay. So, one of the things I said about the pressure increases, that's one thing, part of your communication with your patient is, make sure they understand that. Okay, make sure that they understand that this particular kind of impression does require a little bit of force when we're seating it, or a little bit of additional pressure, of these kind of words. Really helpful to me if you can actually just resist me when I'm putting the impression tray. Especially on the upper, because what they'll want to do is their head will want to come back with you as you push it. Your white wafer just goes across the top like that. Secure the heel so it's not floating about. Okay. So I'm seating it from the front, making sure I'm central. But then what I actually need to do now is a big stretch for me. Thumbs in. Support the mandible. Good amount of pressure down. Well done there. Okay. Keep pressure on the tray because this will bounce back. Because it's silicone, it wants to bounce back. I'm just releasing the soft tissues there. Keep the pressure on. If you want to move your head a little more forward now, you can do. Okay. And I even let the patient close a little bit so that it's comfortable for them. But just remind them that my fingers are in there. So again, with the silicone, what you're looking is making sure that this oozes out. If you don't get any oozing out, you've not pushed it far enough down. Now we don't have to wait for this to completely set. You can take this out part way through setting and get going with the second stage. Just wait to wait for it to go off slowly. I'll pop that out for you, okay? And it comes out ever so easy because it's not locked in to any of the teeth, any of the endocuts. Right there. So what we do, we peel that out, and we've got a reflection of the teeth. Okay? So again, a deep tray, but no anatomical detail. Okay? What we're now going to do, okay, so we've got a light-bodied wash here. Keep the tip of the firmly down into the impression, okay? But I don't want you to drizzling from a height, okay? You also don't want air bubbles in your mix. So just keep it firmly in the bottom and fill the impression back up. Like so. because this is fluid. It just ever so gently eases back in. Okay. So what I'm doing now is just keeping, same as our alternate, I'm just keeping a little bit of light pressure on there, just my fingers are just in contact with it. And just so I'm keeping in contact with my patient so that they don't feel, well, they feel reassured really that you're still there. As I said, you never let go of your patient or the impression during this process. And this takes about 2 minutes to set. Taking it out too early will affect your impression, okay, because you'll end up with a load of voids and drag marks, which means you end up having to repeat the whole 2-stage process again. Okay. So here we go. And it comes out with a little bit of a snap, so just open a little bit for me. And I have my thumb there to protect the top teeth, so it doesn't bang, the tray doesn't bang off the top teeth. Well done. Okay.